Dealing with a medical condition as a pilot can be intimidating. While you need to take care of your health, there are common medical conditions that the FAA's Airman Medical Branch knows can be controlled without annual FAA monitoring. So they created a fast-track system, a shortcut if you will, that makes going for a medical a lot easier and a little less daunting. Let's cover it next on 57 Seconds to Safer Fly. CACI or CACI stands for Conditions AMEs Can Issue. These conditions include hypertension, asthma, prediabetes, certain cancers, and more, 20 worksheets in all. The worksheets for these conditions are part of the CACI program. You can find them at the link on your screen. Each of the links in the worksheet table lead to guidance that the AME uses to evaluate your condition. Read through it, and if your condition merits the use of a worksheet, click to download. For example, hypertension, simply download and print the worksheet and present it to your AME along with a current detailed progress note from your primary care physician. You can be controlling your hypertension with up to 3 medications. However, some pills you're taking could have more than 2 medications in the one pill, so be aware of that. 4 or more medications means a special issuance. You can find the hyperlink to the CACI worksheets and their associated guidance documents and instructions in the video description for this video, or use the web address on the screen. I'd like to thank Sarah Newton of the FAA's Airman Medical Certification Branch in Kansas City, Missouri, for the guidance that she gave me in making this video. For the FAA Safety Team, I'm Phil Dixon.